Good afternoon, everybody. I hope you're all well. So today our topic is gynecological health. Okay, let me introduce myself. My name is Anjali, and I am women's health fitness coach and nutrition counselor, and as well as I'm the founder of this platform. And so today we have Dr. Elizabeth coming. I'm so excited. So, okay, so I'm going to read, I'm read Dr. Elizabeth's bio, okay? So Dr. Elizabeth Goulding is, here she is.
Hi.
Hello. Hello,
How you
Dr.
going?
Elizabeth, how are you?
Good.
Thank you for making time to come here for our platform and to educate our
Oh,
community.
it's my pleasure. Thanks so much for having me.
Yes, because you've been doing the gynecological, about this September month. So I'm like, oh,
Yes.
I'm gonna reach out to her, see what she says. And you
Yes.
said yes. Yay.
Yay.
I'm so excited. Hello, everybody. Welcome. Thank you so much for being here. And so I'm just about to read Dr. Elizabeth's bio. So Dr. Elizabeth Goulding, am I saying it right?
Yes.
Yes. Okay. Is highly experienced clinician holding a fellowship from the Royal Australian and New Zealand College of Obstetrics. I have to, my accent doesn't help. And gynecology, in addition to a subspecialist fellowship in gynecological oncology and a master's degree in public health. Dr. Goulding has always achieved excellence both academically and for her patients. She excelled throughout her fellowships and was awarded first place in her subspecialty examinations. Congratulations. That
Yeah.
is amazing. It's like in everything you are like excellent. That's amazing. Thank you. Caitlin says, yeah, would love to ask. Yes, so regarding the questions, we will have we will have to go at the end because we will do the Q&A session at the end. But okay, just hang on. Okay, can you read the Caitlin's message?
Yes. Yes.
So would love to ask, it is common for females to have such a nasty experience in hospitals to help with the pain. I have endometriosis and would love to find a gynecologist who can help with my pain management as it's now a daily pain. Maybe we'll just start with this question if you like, if you don't mind.
Yeah, absolutely. I think it's a really good question. And sorry, just making myself comfortable. It's a really hard thing, and I think that something that I see all the time, unfortunately, is that patients with endo and chronic pelvic pain often feel and sometimes are dismissed when they present to hospital.
Mm-hmm.
You know, people may make poor assumptions such as, oh, you know, opioid seeking and that sort of thing. And also I think that because endometriosis related pain is not something that you will necessarily be able to see with imaging or scans or bloods,
Mm-hmm.
you know, people sometimes don't feel that they're believed by clinicians. And unfortunately, I think sometimes that can also be the case. So I think that part of solving this problem is the fact that we are actually, I think, diagnosing this condition a lot better now. We're certainly diagnosing endometriosis a lot more commonly. And I like to think that with the new generation of doctors like myself coming through, that women and patients are actually being listened to because, you know, women's health does matter. And actually, endometriosis is a real disease. It's a chronic disease. It's a debilitating disease for so many patients. And it's also a really silent disease. You know, scans are often normal. Blood tests are often normal. You know, and a flare can present in so many different ways. It really is a whole body disorder and can present with so many different symptoms throughout so many different systems. So I guess, you know, in terms of, you know, how do we address this issue? So I think it's you know, I'm hopeful that there is a new generation of medics coming through who are better at it. B, that's part of the reason that I am so loud on social media, is I think that it's all about educating both, patients, but also my colleagues, educating patients to be able to advocate for themselves, and educating doctors about endometriosis and its varied presentations. And, chronic pain is a challenging thing to do because, to be honest, I don't think we're very good at it in the medical field, because it is such a multifaceted problem. And often, unfortunately, acute presentations don't deal with it well, because, you're not dealing with the many facets of chronic pain in an acute setting. I think it's really important for patients with endometriosis and chronic pain to, have continuity with their practitioner and be looked after by someone who's really passionate about treating every aspect of the woman. It's not just about the noxious stimuli that is caused by chronic inflammation in the pelvis. It's not just about the hyperactive pain pathways that will interpret non-painful stimuli as pain because of how hyperactive those pelvic nerves are. But it's also about, I think, psychosocial aspects. And I think that pain is also amplified when people don't feel heard and listened to. Pain is amplified by feeling helpless. Pain is amplified by loss of sleep. So, I think seeing someone who can be your primary caregiver, who understands and is passionate about that, but also can tee you up with other modalities to help with chronic pain. And that would include, psychology, chronic pain doctors, chronic pain specialists, nutritionists employing a Mediterranean diet. I also really believe in things like yoga and mindfulness, gentle movement, and movement in a way that isn't sore for you is also really important. And other natural things like, acupuncture can also be helpful. But I guess at the end of the day, I'm sorry, Caitlin, that you've had that experience. And I'm sorry to say that you're not the only person that has had that experience. And I hope it never happens to you again. And I think, as an endo community, we all need to work together towards giving our patients better experiences to lead to better outcomes.
Amazing. So you have already started it's like almost so much information in there. Caitlin, I hope you got the answers to your question, and you have, put it together so beautifully. Thank you so much for that. And yes, and I wanted to let everyone know that this topic that live we are doing is for the educational and awareness purposes, but not a specific diagnostic for anybody. So if you are, if you have a gynecological issues or some sort of concern, please go and see your GP or, the practitioners. Okay, so before we jump into the questions, would you like to add in anything else? You have already started with the big open.
Yeah,
So yeah.
happy to go to the questions and happy to answer things on the fly as well as things come through.
Yes. Awesome. So we are open to questions. So anyone, if you like, comment down below if you have any questions. So I just wanted to start with, what is gynecological health for the people who are not sure about this term?
Yeah, so gynecology means the female reproductive tract. I think in medicine, we're good at making things sound a lot more confusing than they should be. So gynecological health is, health of the reproductive tract. I think these days we can't necessarily assign a gender to that, because obviously there's a lot better understanding that gender is a learned thing and it's not something that we're born with or that we're given. But it's health of the reproductive tract of women or of patients with, XX chromosomes. Gynecological health, I think, really covers many facets. It's about sexual health. It's about, the physical health, looking after ourselves. I think a lot of what covers gynecological health is also about, preventative health and education. Big things, I think, about gynecological health from my point of view is, destigmatizing gynae health. I think, traditionally women have been, very reluctant to talk about women's problems, and I am hoping of growing out of that and being able to talk more openly and more widely about, you know, things that are troubling us, or, you know, problems with our vulvas, or, you know, issues with our cycles and all of that sort of thing. So I think gynecological health is about awareness, it's about prevention, it's about being well, and I think it's also about a community and, you know, us being able to talk to each other about what's going on for us.
Yeah, that is amazing. That is what we are doing, right? To bring the awareness in the community, because there are the women who watches our live from Nepal, and in Nepal, it's, you know, with the women's health is like big no to talk about it because it's a shameful thing, right? So with our live, it's not just our community here, but we are impacting internationally, like women as in Nepal. So
Yeah.
thank you so much for that. Yes.
And I think
So
that's too, because culturally,
mm,
you know, I think in Australian Western culture, I think we're getting better, but we're still not perfect. But, you know, people from other diverse cultural backgrounds, it is still viewed as a shameful thing to talk about.
yes, yeah, absolutely. That's why that is what one of my passion is, to educate women. That is why what pushes me, because I personally went through that time, right? Grew up with it, and they not knowing much about the women's health and all those things. That's why I'm so passionate about doing this, what I do. So,
Yeah.
and yeah, and support like yourself from, you know, practitioners like yourself, and we truly appreciate that. So, yeah, and what are the most common issues that you have come across, you know, in your practice, at your practice?
Yeah, so I guess I can flesh that out. So I wear two hats. I am both a gynae oncologist, so I'm a gynae cancer surgeon, and
Mm,
I do that publicly. So I work out of the Gold Coast Uni Hospital. I'm one of just two women who do all of the cancer surgeries for women with a gynae cancer
mhm,
everywhere north of the Gold Coast. And so with that hat on, you know, the most common thing that I see is unfortunately cancers, but unfortunately,
mm,
you know, 14 to 16 women will be diagnosed with a gynae cancer,
mm,
and survive their disease. So even though gynae aren't the most common cancers that women suffer from, you know, they do affect a lot of Australian women, and so and globally, obviously, as well. And globally, we see different rates of different cancers. For example, higher rates of cervical cancer than we would in Australia. So, with my cancer hat, that's sort of what I look at. But then when I work privately out of Gold Coast Private, I see a very different group of patients, which I love because it just brings so much diversity to my work.
mhm,
Really, the things that I'm dealing with a lot is endometriosis, chronic pelvic pain, adenomyosis, dysfunctional bleeding.
right.
But I also have a lot of patients with vulval concerns. So
Mm,
I see vulval health. So any concerns, weird lumps or bumps, you know, I'm the
mm.
person. I also spend a lot of my time educating patients and talking about abnormal pap smear results, which I think is something that is really common, ovarian cysts and abnormal
Mm.
bleeding, particularly post-menopause bleeding.
Yeah, so the education is so important, isn't it? So
Very much.
educate, yes, and that helps us to understand what we are going through, not just do this and do that.
Yeah.
And when, yes.
I think
So,
it's really an important point, and I think that if you see a doctor who hasn't explained what you've got, you should ask, because I spend a lot of my consultations actually breaking words down and saying what they
mm,
mean and explaining what something is before you go on and talk about the management, because I think it's just so important that we educate our patients so they actually know what's going on in their bodies, because that in itself is an empowering thing.
yes,
And it also, you know, puts, I think it just really helps your therapeutic relationship with patients, but also gives them a better understanding of, you know, the reason that things are happening in their body. And also, I think will hopefully enable them to better identify when things are wrong and they need to look out for help.
yes. So they, with the, yes, advocating yourself for yourself, right? The, if you're not sure, be able to ask. And then, but with the people, the women who comes from the third world countries, like such as myself, we always rely on our husbands, or for them to question for you, because
Yeah.
we were never taught to do that. So, maybe the practitioners could little bit give a nudge to women when they come with their husband, with the other side, from the other side of the place, if the women are from there. So yeah, I think that would be really helpful as well.
Yeah.
Yes. So Mama Endo Warrior says the incredible doctors at Grace Private are your women, Caitlin's, that have your back in everywhere possible. Oh,
Yeah, it's very
awesome.
yeah, my colleagues at Grace are all incredible doctors
Yes.
and women, and that's why I chose to consult out of the rooms at Grace. So I think it's really important to work with a group who share the same beliefs as you, who have the same ethos and compassion that you have, because we all work together and we inspire each other. And I think, I'm proud
Yes.
that we do a good job.
Yes, no, I love going there, visiting there, because everyone is like, from the reception to everyone is so amazing. And for our event, we had Dr. Francis Nutt for the guest of panel, and it was just a beautiful combination. So
Yeah.
yeah, so I love visiting there. I
Yeah,
don't
it's
know.
great practice. We also have, we really like to focus on, holistically approaching women's health and having multiple disciplines under the same roof. So, we obviously have our surgical gynecologists like myself. We also have, reproductive specialists, obstetricians, and then we have our endocrinologists, dietitians, psychologists, and our beautiful nursing staff as well, who offer Monday to Friday support for our patients. So it is a really nice model that they've built at Grace Private, that we hope that we can try and address the many facets of
Yes,
health.
yeah, beautiful practice with beautiful people. It makes it like top notch. It's amazing. So so how is the future looking for our women's health? If what can you see? How is it going?
Yeah, I think that's a great question. I I think that the future for women's health. So I guess I'll address that from, say, for example, a cancer point of view. I think one of the big issues in the future for women's health from a cancer point of view is, growing rates of obesity in the population. And as a result of that, we are seeing, increased rates of endometrial cancers, to the point where, 1 in 30 women are getting an endometrial cancer now. And so that is something that is presenting a lot more commonly, but we're also seeing these cancers present in younger women. So
Mm,
much more increased rates of, women under the age of 40 having endometrial cancers, and having to have discussions about treatments that will, rob them of their fertility. And so that is, I think, a really big thing that I'm certainly seeing in the cancer world. From a benign gynecology point of view, I think the future for endometriosis is definitely getting brighter. I think that the journey with endometriosis is just so challenging. It is a chronic disease that we can't cure. However, I think that we have a generation of specialists who are extremely passionate about changing patients' outcomes with endometriosis. There are new drugs that are coming onto the market. We're also, we're better surgeons these days. So,
yeah.
I'm of the generation that grew up with laparoscopy, oncologically trained, know my way around a pelvis with my eyes closed, and I work with a lot of other specialists who are excellent laparoscopists. So we're doing a better job of excising endometriosis. I think we're getting better at our education. I would like to see more multidisciplinary teams in the future being available publicly. I
Yes.
think the future for, I would love to be able to see the same resources available as readily and as easily to public patients as they are to private patients. And I think that really is the big difference for endometriosis for patients who are public versus private. And I think that, I would love to see in the future decreased wait times and more resources being given to these really, really important issues that affect 1 in 6 women.
Yes.
Another thing that I would really like to see in the future for women's health is it prioritised from a Medicare point of view. You know, HRT isn't covered by the PBS. It's crazy. I would love to see, you know, I think the future of women's health is going to see us be more educated about hormone replacement therapy. I think it's going to see us be more liberal with prescribing it. This is something that I'm very passionate about. You know, of all the hormones that you can be deficient in, estrogen is the only one we don't replace. If you have a thyroid deficiency, it'll be replaced. If you have a growth hormone deficiency, it will be replaced. If a man has testosterone deficiency, it will be replaced. Yet we're not replacing estrogen in perimenopausal women, and we're seeing huge, you know, numbers of women suffering with terrible quality of life from menopausal symptoms that should otherwise be treated. And I think there's a lot of anxiety around HRT generated from a very poorly done study 20 years ago. So I think in the future of women's health, we're going to see that change. And I'd love to see hormone replacement therapy be accessible and affordable. For some reason, what's it called? The erection drug. What's that called? The one that all the men love. That's on the... Pardon?
Blue pills. That is what I know.
Yeah, the blue pills. It's just gone out of my mind, the name. The blue pills are available on the PBS, but HRT isn't. I just think it's crazy. So that's something that we need to see change in the future. So I think there's a lot of bright things coming, and I think that we're going to continue getting better at, you know, managing and Viagra. That's it. I can't believe Viagra is on the PBS, but hormone replacement therapy is.
Well done.
And this is even for patients who I have with cancer, who are menopaused from their cancer treatment, who need HRT for, you know, medical reasons, and they can't afford it in their 30s. It's heartbreaking. It's terrible. I mean, and next month on my Instagram, I'm going to start talking a lot about HRT and tagging a lot of government agencies, because it's just unacceptable.
Yes, no, that would be a great step. And if any way, if I can help, you know, to spread the message, and I'm here, I'm joining the team. So so Caitlin is asking, how do I book in with you?
Oh, you just get a referral via your GP to me and send it to Grace Private.
Yeah.
You'll find me.
Awesome. So you got the answer. And now before we go, so if there is any few preventative ideas that we could, you know, minimize our symptoms of all this gynecological cancerous or whatever. So how can we do that? Do you have any?
Yeah, 100%. Stay up to date with your pap smears. I recently put a post up about myths around pap smears. So I think it's really important to know that, you know, if you've been sexually active in the past, male or female partners, and you're over the age of 25, you do need a 5-yearly smear up until the age of 70. It is so important. The majority of women we diagnose with a cervical cancer are underscreened. And this is a cancer that we can pick up in a latent phase. We can treat it early, and we can stop people dying from their disease. I think it's very important to make sure that you always get investigated for a new onset of abnormal bleeding, even if you're still within reproductive age, because there is no screening for endometrial cancer or endometrial precancer. So it's extremely important to be aware of that and to make sure that you get checked. I also think it's really important that if you're worried and you see a GP, that you ask to be examined. I see so many patients, unfortunately, who have not been examined. I've met patients with vulval cancers who've been seeing GPs for 18 months and no one's ever looked. So important for us to advocate for ourselves and make sure that we get a thorough assessment when we present for a gynecological problem, and that people actually take their time to listen to you and to examine you. What I would say about other, you know, common health conditions such as adenomyosis and endometriosis is get onto it early. And I also think that, you know, women often feel like we're meant to suffer. And so I feel like a lot of these menstrual disorders are picked up really late because people just spent years of their lives suffering and having, you know, intolerable pain and unacceptable pain. So, you know, if you need to take a day off work, or if you can't get through your period without pain relief, or if you're so sore you can't move, or if you're feeling more than a pad an hour, that's not normal. and go and get checked out, because there are things that we can do to help you and to improve your quality of life. And I also think that achieving a diagnosis is also really empowering for women. So many patients that I've had after, you know, an endometriosis excision, and you have their histology and you say, you know, you had stage 3 endometriosis, it's been completely excised, here it is on the histology report, and they just cry with relief because they're like, oh, I'm not going crazy. You know, the fact that we even think that we're going crazy because we've got a problem is just, I think, really an indication of how attitudes in our society need to change. And so I think, you know, often, you know, having a physician who you have a great rapport with and getting a diagnosis is a very empowering thing for patients as well.
Yeah, that is just, it's amazing that how you are advocating for all this, you know, our women's health issues. And, you know, we would love to be add in the voice to make it louder so people can start, you know, like practitioners as well as the politicians and, you know, and general people can start, you know, speak up about it.
Exactly.
And yes, and that is, amazing. And so if anyone has questions, we would love to keep talking, but we have, the time is a little bit limited. So anyone has questions, please, you know, comment down below. And while we're waiting, please let us know where we can find you, where people can find you.
Can find me?
Yes.
So obviously I've got an Instagram page and I'm always putting things up, but I also love to put things up that people want to hear about. So, you know, drop me a message, write a comment. And I really get a lot of pleasure out of being able to communicate with, you know, my women's health community and be able to ask and educate. I also have a website, drelizabethgoulding.com.au. I think it's quite a useful resource. I've got a lot of patient information there. If you want to book in with me, just getting a referral through GP to Grace Private is all you need to do, and pop my name on top. And you can come and see me at Gold Coast Private Hospital.
Yeah, thank you so much. Caitlin says, thank you so much for actually being our voice. And so Jerusha, she says, thank you. Wonderful to have someone so passionate about this. And Mama Endo Warrior, crying post excision. Is that how I say it? Excision?
Yeah,
because you know you're not crazy. Yes. Yeah, I was told that once I have the children, then I'll be fine. So until then, I just have to pop in the pills. And he was back in Nepal. So, and, you know, we couldn't talk much about it. I just took the painkillers the whole time.
Yeah.
But anyway, now, So thank you so much, everyone, for being here. Dr. Goulding, you know, it's been such a pleasure to have you here and to, you know, to bring the awareness in this topic, and we are forever grateful. And so thank you so much.
And thank you so much for what you do. You're a very inspirational woman, and you know, I think a community of people who are all about health promotion and awareness is so important.
And truly supporting women, right? So
absolutely,
that is what I stand for, and let's do this together, right? So thank you, everyone, for being here. Okay, bye.
Thank you.
Bye-bye. Thank you so much.